Good morning, good afternoon. It's a beautiful Friday morning here, and I'm excited to welcome you to another wonderful STEM series. Depending on where you are joining us from in the world, I want to say good afternoon, good morning, and you are welcome to this wonderful session. I am looking forward to it. It's an absolute pleasure for me to welcome all of you to today's session. My name is Florence Topher, and I am the Director of Mobile Web Ghana. And I'm happy to be here. And this program is being brought to you by American Corner Agbogba, the US Embassy, in partnership with Mobile Web Ghana. I will be your moderator for today. I am presenting from American Corner Agbogba. And as you know, American Corner Agbogba is part of American Spaces. And American Spaces provide access to current and reliable information about the United States. And we are doing this through wonderful book collections, internet access, great events and activities for everyone. So no matter where you are, you can join us for activities and you can participate and benefit from it. Our topic for discussion for today's session is artificial intelligence in health and poverty alleviation. I mean, there's a lot of talk about artificial intelligence, the power of artificial intelligence, and other side effects about artificial intelligence. I am so excited that today we are going to talk about how we can use, or we are actively using artificial intelligence in health and poverty alleviation. Our esteemed facilitator for today's session is Professor Samuel Kofi. And Professor Samuel Kofi is the head of the Department of Biomedical Engineering, School of Engineering Sciences, College of Basic and Applied Sciences, University of Ghana. Professor Samuel was an affiliate assistant professor at Department of Medicine, Loyola University of Medical Center, Chicago, in the US. He was a distinguished visiting international lecturer at the Department of Physics and Engineering Science, Coastal Carolina University, Conway, South Carolina, USA, and currently serves on the Board of Engineering Program at CCU. He is a life member of Wilson College and was a Capres Research Fellow at the Department of Veterinary Medicine, University of Cambridge. He is an affiliate of West African Center for Cell Biology of Infectious Pathogens, Department of Chemistry, Cell and Molecular Biology, and West Africa Genetic Medicine Center, University of Ghana. Samuel has pioneered the use of artificial intelligence, machine learning, bioinformatics, and computational bioengineering to support novel drug discovery and diagnostics. He has embedded AI and big biomedical data to develop various open source applications, including Tablet and Ebola Breed. Ebola Breed and Tablet support the discovery of potential drugs for Ebola virus disease and cancer, respectively. He also developed the first ever online relational database on Buruli cancer drug discovery, known as BAB. Prof. Samuel takes keen interest in STEM, especially for young female students, and this has taken him on various outreaches to selected schools across the country. He has trained numerous students and researchers in AI and bioinformatics and periodically organizes training workshops. And this session is one of those sessions that is here to give us knowledge and information about how AI can be applied in the health sector and also in poverty alleviation. Over to you, Prof. I want us to take us through your presentation, what you've got for us today.
I'm so grateful for you for the invitation. My talk is on artificial intelligence in health and poverty alleviation. I'm the head of the Department of Biomedical Engineering at the University of Ghana. Biomedical Engineering Department, we are the leaders in biomedical engineering education in Ghana, as well as the sub-region. And at the University of Ghana, we've had 20 years of transdisciplinary experiential engineering education. What is the definition of artificial intelligence? It's any technique that enables computers to mimic the human brain. Any technique that enables computers to mimic the human brain, perform tasks intelligently, to make decisions, and to navigate challenges as a social. According to the United Nations Sustainable Development Goals, there are 17 SDGs. Based on the topic, there are four of the SDGs which encapsulate the topic or the talk today. That is no poverty, quality education, good health and well-being, and reduced inequality. If you are able to address issues of health, cost of health, accessibility to health, then there's the possibility of decreasing poverty. And then good health and well-being. If you have good health and well-being, it more or less includes you. There's a possibility that you could have a financial inclusion, and this may decrease the gap between the poor and the rich, and those in the urban areas and in the rural areas. And this could lead to reduced inequalities. And then we have quality education in terms of training healthcare personnel, using social media communication in terms of health, giving public health education, and all this encapsulates, if well articulated and implemented, will be very good for social good with respect to artificial intelligence. We are academics. We are the university at the Department of Biomedical Engineering, together with our colleagues in computer engineering and other institutions in the South region. We recently published a book chapter on artificial intelligence and health in Africa, opportunities, challenges, and ethical consideration. And this book chapter, as part of the other work we've done, inspired this talk. What are the applications of artificial intelligence in AI? There's drug discovery. AI considerably decreases the cost of drug discovery because manual intervention and laboratory intervention and intervention devoid of computational techniques makes the drug discovery processes very, very expensive, laborious, and takes a very long time. So drug discovery, when it comes to AI and computational drug discovery, is really contributing to the cut in the cost of running a drug through a proof of concept for it being approved via clinical trials. And then you have medical diagnosis, dosage error. AI-assisted a pharmacy assistant could help in issues of dosage form. And then for cancer research, we have done that. For personalized healthcare plans, if an AI model is built comprehensively with your data, optimized and trained with your data, and it could more or less aid in personalized care plans. And then you have virtual nursing assistants. These are nurses or applications based on your phone or based on a web-based applications, remotely based, and could help you in terms of your nursing needs. In terms of fraud detection in healthcare, cybersecurity is important, gene editing, manipulating the DNA of individuals who are sick or with specific diseases as a form of therapy. And then you have the AI-assisted surgery. That is AI robot-assisted surgery. How do you use robots assist in the surgical rooms? How could medical doctors use robots to more or less assist when it comes to complicated surgeries? And as part of the work we've done, we also publish a work when it comes to drug discovery, and we more or less look at big data. Of all the areas that I've highlighted previously, you require big data. In artificial intelligence, big data is the new gold. With data, you'll be able to develop any AI applications or models or robots to perform a specific task, be it in healthcare or other form. For us, our primary interest is in drug discovery. So we use comprehensive big data on drugs, and we use this data to train algorithms. The algorithms can learn on their own and then use that to build models. And these models will be able to classify drugs, whether the drugs could be a potential cancer drug or a potential antiviral drug, a potential drug for HIV, a potential drug for Ebola virus disease, a potential drug for Buruli ulcer disease. And once the AI application has done this prediction for you, you can go to the lab and test these compounds. Why? Instead of buying 1 million compounds and testing, AI can more or less prioritize few compounds, which you can purchase, test in the lab, test in animal models, and then test further and use for clinical trials if successful for FDA approval. We also looked at a review article where we looked at the essence of artificial intelligence, machine learning, and big data for Ebola virus drug discovery. We've worked comprehensively on Ebola virus. And based on that, we developed a system known as Ebola Pred. And the Ebola Pred is basically a web-based AI application which enables the identification computationally of potential Ebola virus disease drugs. And once these drugs are identified, experimental laboratory testing could be done, and further pharmacological analysis could be done down the drug discovery pipeline. We celebrated the development of Ebola Pred, and this is basically a publication of Ebola Pred. And this is a journal article for the Ebola Pred, which was published in the Elsevier Journal Computational Biology and Chemistry. This basically the interface of Ebola Pred that gives you the QR code for you to scan to the web-based application. And then basically we also developed a system we call 2Pred, and 2Pred has the potential to identify drugs or compounds which could be used for the treatment of cancer. And this is a basic interface of 2Pred. And what 2Pred does is with your compound or drug which you are interested to do research on to see if it has potential to be used as a cancer drug, our web-based application will do all the AI analysis, the machine learning analysis, and will do a prediction for you. And based on the prediction done for you, if it's predicted as a potential drug, then you will have to do experimental testing. It cuts down the cost, and then it also speeds the time from proof of concept to the acceptance or approval of the drug. And then we've used computational techniques, including artificial intelligence, and we've identified potential compounds or potential drugs for COVID-19. And some of these have been tested locally in Ghana and with our collaborators at Mayo Clinic in the US. And based on our understanding of Buruli ulcer with our collaborators at the Department of Biochemistry, Cell and Molecular Biology at the West Africa Center for Cell Biology of Infectious Disease and Obuchi Memorial Institute for Medical Research, we built the first Buruli ulcer drug discovery database. And the insights from this Buruli ulcer drug discovery database led us to a discovery which we published with a provisional patent known as a broad spectrum multi-target antiviral active in picomolar. Just to break down this, we basically have identified a compound known as mycolactone, which plays a role in Buruli ulcer disease mechanism as a potential antiviral drug for COVID-19 and other viral diseases. And we have successfully filed the patent application. We successfully filed a patent application at the Patent Cooperative Treaty and the US Patent Copyright and Patent Office. And then also based on our work in diagnostics, we have used microscopic images of Leishmania parasites, and we have used this to aid in accurate and precise and sensitive and specific identification of Leishmania parasite. And this is an in-house system we've developed, and the proof of concept has been successful, and we are yet to deploy. And then, as I said previously, we've developed a system for prostate cancer, an AI system for prostate cancer based on images that we call the interpretable deep learning model, which will help in accurate diagnosis. And then our students in 2022 at the 3rd National Biomedical Engineering Conference, organized by the Ghana Society of Biomedical Engineers, won the best innovation or the best research award paper, and they came out as the best. And the team is known as Team Deep Breath, University of Ghana Department, and they developed an automated diagnosis system which uses chest x-rays or chest images of COVID-19 patients that lead to, or it results in accurate diagnosis or improved diagnosis of COVID-19. And what are some of the applications beyond what we've done at the Department of Biomedical Engineering at the University of Ghana? We have what is known as a Da Vinci surgical system. It's a robot in the theater room, a surgical robot, a robot in the surgery room. So it basically aids the doctors, and any errors, it minimizes potential errors. For example, there could be blood loss. It's minimally invasive, and it's been shown that possibly it could decrease patient stays in hospital, and it comes out with efficient surgery. And then you have telemedicine. I can be here in my office with medical complication, and there can be a surgeon at Kolebu Teaching Hospital or Konfanochi or somewhere at the teaching hospital in Tamale. And then basically using an application on my laptop or on my phone will be remotely sent to the specialist overseas, and the specialist overseas can do all the diagnosis that need to be done and provide therapeutic intervention and medical advice. So AI-powered telemedicine system is very, very important, and you can have a wearable device, and the wearable device may be more or less integrated with a telemedicine system that will give continuous monitoring of your medical condition. And the telemedicine, which is deeply incorporated with AI, reduces the need for in-person visits. It's very, very important. Instead of traveling all the way to the hospital in a bigger city, several kilometers away, the most important thing is the telemedicine and other forms of remote AI applications will enable you to have better healthcare. And then during the COVID-19 pandemic, we had a lot of crises locally and elsewhere, and AI played a major role. What are some? As I said earlier, big data is very, very important. So you have COVID-19 screening data from laboratory test kits. You have a patient in a hospital who is being quarantined or isolated. Samples are taken from the patient, 19 patient images, microscopic images. You know the epidemiologic data, surveillance data. All these are incorporated into machine learning models or deep learning models to build systems that aid in sometimes monitoring of the individual patient or large-scale surveillance using molecular epidemiology and AI techniques for public health purposes. We have also developed the circle charts, and the proof of concept has need to be basically a regenerative application which helps the management of sickle cell disease. So it's a web application for sickle cell healthcare. So patients individually, families, medical personnel can basically consult it and ask simple questions, and it will answer. Use localized data sets integrated with other data sets to optimize the model. And then Emmanuel Kisi, who is a teaching assistant in my department, who I supervise his undergraduate project together with a friend, have developed the Revived AI, which is a localized health AI web app. So basically, it's an AI herbal assistant where you may be able to ask certain questions. The application will assist you answer various questions on treatment. These are basically applications to assist, and users are basically advised to consult specialists when in certain situations, consult specialists. The caveat is the systems being developed using AI, which are web-based, are not medical doctors, they are not substitute for nurses. They are basically to complement the existing services or infrastructure or applications available. And then what are some of the healthcare applications of AI in Africa? There's the CAD4TB, which is basically an diagnostic tools for pulmonary tuberculosis. So it's basically helps within the diagnosis of tuberculosis, and it's used in over 33 countries. And the Canadian-made app known as Ubenwa basically helps detect asphyxia in babies, and it's been implemented and used in Nigeria. And then I'll show a video of a simplified AI system for fetal ultrasound in low resource setting. This was developed by a group, and the reference is here. So basically, this is an ultrasound device, which is the size of a mobile phone connected to a tablet. And this helps midwives, nurses, traditional birth attendants in the rural areas where otherwise sophisticated, complicated ultrasound machines or imaging machines could be there or will be there to aid in risk detection during pregnancy. Simplified device has been made available. It is low cost, it is efficient, it eliminates the need for expert handling, complicated risk identified, more or less telemedicine is used and transmitted to experts elsewhere who gives prompt medical intervention, and this improves outcomes. For example, the market women, the pregnant women would have to travel from the remote areas, from the rural areas to major cities or private clinics in the major cities or urban areas. And these services are very expensive, especially in Ghana. So very low cost, certified device, basically for scanning and pregnancies of women, and could be used for prenatal, antenatal healthcare to determine risk. And this similar one has been developed in Nigeria, known as the Health. And this was basically a collaboration between the Nigerian government, which pumped in $20 million, General Electric, an American company. You know that Nigerian is ranked #1 for maternal mortality in sub-Saharan Africa, and there's around 40,000 mortalities annually. And this partnership crucial. VScan basically it's a non-invasive ultrasound device the size of a mobile phone, which they developed, which looks similar to the one I showed in the video elsewhere. It gives real-time, high-resolution, very quality images of the chest, for cardiology, for obstetrics, for gynecology, very, very quality images for the midwife, traditional birth attendant, the medical doctor, the nurses. They do not have to travel to the bigger cities. They can have time to work. They can have time to go to school. They can have time to attend. They can have time to do their business. In this case, government can also reallocate scarce resources to the other sector of the economy, specifically in health or other sector of the economy, to poverty. So this is very, very important. And what would it do? It helped, they anticipated it to have helped 560,000 mothers who otherwise did not have access to healthcare, did not have access to healthcare facilities, who did not have access to healthcare facilities. And what does it do? It can detect a defect in the fetuses and even monitor high-risk pregnancy, very high-risk pregnancy. Device can even detect the position of the fetus in the womb or complication. And it's basically a hand for scanning, which is based on ultrasound technology, and it's very, very, very. And then a similar system has been developed in Guatemala, which basically integrates ultrasound specimen. And basically, what does it consist of? It consists of a laptop, ultrasound USB probe, you have your dry blood plate, you have your backpack, external batteries, and very important, solar panels, foldable, portable solar panels, because access to electricity, to energy, to power is sometimes very scarce or difficult in remote areas. And this helps prenatal, antenatal. And then in Malawi, for example, has 2.81 million internet users as of January 2020, and 8.58 million mobile phone connections, constituting about 45% of the population. And Malawi, for example, has made very good use of AI, specifically relying on internet connectivity. And what have they done? Patients within remote areas, very rural areas, wouldn't need to travel to the doctor. All what they need is the app. And they get attended to without having to travel to a clinic. And if you have routine medical, if you have medical complication that you need routine then there will be a reminder. The app will give you health tips. It provides you information on risk for prenatal, risk pertaining to postnatal and pregnancy, and it gives information on HIV transmission, treatment options. It guides and it makes their life very easy. And then we come back here to Ghana. In Ghana, there's a company, Mino Health AI Lab, is doing wonderful things. And they basically, a lot of their work is based on using medical images as the source of big data for analysis to develop the AI. And basically, they've done work on radiology. They've used images, and they've done work on diagnostics. So basically, they are funded, or they've obtained funding from Bill and Melinda Gates to support such work. And such work is very, very easy. With images, you can develop AI applications for cancer, for diabetes, for tuberculosis, for hypertension, for any other complicated diseases. And they've done already some of this technology is being used by hospitals and diagnostic centers within Ghana, especially the one funded by Bill and Melinda Gates. They've worked on malaria diagnosis using artificial intelligence. The West Africa Center for Cell Biology of Infectious Pathogens had also developed an AI system as part of a PhD student's work to help in accurate malaria parasite diagnosis. And the Mino Health has also developed AI system which for immune-resistant anti-malaria antibodies, all about malaria drugs, or all about malaria detection and diagnosis. And they've done fantastic work when it also comes to breast cancer. And there's also other work in Ghana, sexual and maternal reproductive health and pandemic prevention, that is AGE project. And they've done wonderful work. And that is backed by the International Development Research Center. And then there's the Responsible Artificial Intelligence Lab, the real lab at KNUST, which is working on developing AI system for stroke diagnosis. And then there's also this company, which known as Intron Health. Basically, it transcribes the speech of the patient to tests. So you go to a medical doctor, you speak in a different local languages, look Africa, the Intron application will basically translate it from that local language to a language the medical doctor or the healthcare personnel understand. And it is an AI system which is real-time clinical speech to text. and for over 200, it's 92%. That means that we do not need a lot of translators in the consulting room of the medical doctors in the hospital. And with this application, you'll be able to interact with a medical doctor or healthcare personnel in a not familiar to the other person. And then coming back to issues of poverty reduction, the impact of AI on artificial intelligence. So AI impacts in healthcare cost reduction projection by 2026. And you see just robot-assisted surgery. So from this simple histogram, you cost reduction when it comes to robotic-assisted surgery, virtual nursing, AI-powered. So these are the areas that we need to invest in Ghana. Robot-assisted surgery, people will say it's contentious here, but we need all this system. Virtual nursing assistant is an area we can also invest in. AI-powered image analysis. The universities, including the Department of Biomedical Engineering, the University of Ghana, together with other innovative AI labs in Ghana, are doing that. Support is needed. Clinical trial participation, administrative workflows is very, very important. How do you use AI to support decision-making in healthcare for accurate, efficient, dynamic decision-making when it comes to healthcare policy management and implementation, as well as administration? And then if you look at the size of the AI market, by 2030, the market size for AI healthcare is projected to go to around $187.95 billion US dollars. So that's the big market, 187 billion United States dollars. And that's a big market size. That's we in the developed country, low resource income areas, under-resourced income areas, including Ghana and other countries in the sub-region, we need to look at the size of the market and then invest in for poverty reduction, access and improvement to healthcare, quality healthcare. And then if you look at the AI Readiness Index, if you look at the AI Readiness Index for 2023, if you look at the scale here, you can see that the readiness for countries in West Africa and other sub-Saharan African countries, the readiness is very, very low compared to other countries. If you look at the interactive map, which means that we need to look at these three indices. Indices pertaining to government, indices pertaining to technology sector, data and infrastructure. Sorry. With respect to government, we need to look at the vision, a proper articulated government vision, governance and ethics. We need to look at this, and digital capacity. We need to look at adaptability. How do we adapt? We need to look at maturity. We have to think about innovation, human capital, infrastructure, and all these indices contributed in the computing of the 2023 AI Readiness Index. And then Bill Gates, for example, when we were in Senegal, recently we were in Senegal, that was last year, with the Gates Foundation, that is a grand challenges, where a lot of emphasis was placed on the role of artificial intelligence in health. And Gates Foundation during that time allocated $30 million towards advancing AI in Africa, which means that government within Africa, organization within Africa, business ventures within Africa need to contribute significantly to AI development. And AI is set to contribute up to 15.7 trillion to the global economy, set to contribute 15.7 trillion to the global economy by 2030, and of which 1.2 trillion could be generated in Africa. So out of the 15.7 trillion contribution to the global economy in 2030, there's a possibility that 1.2 trillion could be generated in Africa. What are we doing? And this represents 5.6% increase in the continent's GDP. Predicted by 2030. The 1.2 trillion could represent 5.6% increase in the continent's GDP by 2030. So what is Ghana doing looking at 15.3 trillion global economy by 2030? That is what we need to do. AI investment also is forecast to approach 200 billion globally by 2025. That's Goldman Sachs. So if you look at the financial indicators, the economic indicators, there is the need to invest in AI. By investing in AI, we cut down the cost of healthcare. There's accessibility. There's it decreases inequality with regard to access to healthcare. It improves general well-being. People can work, resources can be reallocated, and this will be able to fight poverty. By mere using satellite images and AI models or machine learning models, it's possible to predict areas or regions of poverty in a country or in a sub-region, integrating this with epidemiologic data on health, data on poverty. It will improve the outcomes when it comes to poverty reduction projection. And that is what we need to look at. And based on the review, based on the book chapter that we did, which was led by Dr. Margaret Ansah in the Department of Biomedical Engineering, for which I served as a co-PI on the book chapter, we looked at the challenges and concerns of AI in Africa. We looked at some of the challenges and concerns we identified were limited infrastructure and connectivity challenges. Oh, in Ghana, we all know about this doomsday story. And then there's also internet connectivity. Internet connectivity is very, very poor across various geographic locations in the country. Even in Accra, sometimes you struggle. So you can imagine the rural areas, internet connectivity. How can there be AI penetration in remote areas, in low resource areas, low income areas, poverty-stricken areas? Is by addressing issues of electricity using solar infrastructure, internet connectivity, and also look at data availability and quality in resource constraint setting. And why? Data sits as silos. So you have fragmented data scattered around research centers, hospital, genomic data, patient electronic data or electronic health data, together with other public health or epidemiologic data. These data sets are fragmented, they are not integrated, there's no crosstalk between these data. Integrating this data is a concern. How do we standardize this data, integrate this data, make it publicly available? The West developed countries have invested so much in AI, and they have lot of data available for which, if made accessible to us in the format necessary, then we could make a lot of inroads in AI. Also, data governance. How do you formulate policies and intervention to assist in data governance? And we look also at cultural diversity and contextual adaptation of AI. Most AI data sets, ethically, they are biased. Most of the data sets were not Afrocentric data. That means that a lot of the data were not collected in Africa, and some of the applications we use were developed using data sets predominantly obtained outside Africa. So how do we look into this? How do we address the issue of lack of Afrocentric data set? Is very, very important. We need to generate our own data set as big data to build the AI models to solve our problem. Linguistic diversity. We have hundreds and hundreds of languages and accents in Africa. How do we address this? There's been text-to-speech, which enables cross-conversation in different languages. This is what is lacking. So much has to be invested in linguistic diversity or computational linguistics to address the issue of linguistic diversity. You have digital literacy, people having this mobile AI web-based app, mobile phone-based app, and not having the know-how to use it, to communicate, to manipulate it digitally, to obtain the required healthcare information or the required data, the required inferences to make them make better decisions when it comes to healthcare. And then there's also ethical consideration when it comes to AI adoption for health, for African health. The algorithms, the data sets, we have a lot of information from the developers. That's where fairness and transparency in AI come. Some of the transfer systems as a black box. And if developers locally and overseas who make available insight into how some of these models were developed, then we in the in resource challenge areas could optimize, modify, adapt, and use it. And sometimes the application are generalized. Generalization in terms of data, generalization in terms of usage, generalization in terms of when it comes to the features of data sets. You need issues of gender, you need issues of race, geographic region, issues of health. All these are data sets, and these have specificities. These have sub-categorizations and the rest. So generalization is a problem. How do we address that? And then what is the way forward? We can't only complain. We must also postulate way forward. We need supportive policies, regulations, and robust infrastructure. Harvard Business School has come up with the AI Ethics Review Committee, and there should be AI Ethics Review Committees in addition to the existing institutional review committees or ethics committees, or the existing institutional review committees or boards or ethics committees need to be equipped with AI ethics review. We need a national data center, which is very, very important. We need a West African data-driven AI application. That's where collaboration comes in, network comes in. We harness the data sets across the continent, the know-how across the continent, the models, the algorithms, the application, the usage. All this is very important. In Ghana here, we need a national AI network with centers of excellence spread across the country within the government institution, private institution, NGOs, business sector, academia. All this network can spearhead the revolution of AI in Ghana, for which we are lacking behind. We need an AI technology ecosystems across the breadth and length of the country. Startups, incubators, investors coming in, government pumping in money, and we need a National Center for High Performance Computing. Building AI model is computationally expensive, computationally expensive, looking at the depth or the amount of data sets that need to be analyzed. If we have the National Center for High Performance Computing, then individual startups, academics, researchers, innovators, inventors could access computational power and develop their models and host their application for free, which should be the case. We need state, private, local, international funding. A portion of our GDP, especially in Ghana, need to be allocated to AI. Anyone who leads AI research, AI investment will lead the world. We need scholarships, we need courses, we need training, we need institutions to run AI courses with practical component, collaborative component, transdisciplinary component, AI health, AI water, AI agriculture, AI environmental. All these experiential-based, transdisciplinary-based training will address some of the challenges that we face. And this will more or less help us in terms of poverty alleviation. And then all these models are being developed. Have we looked at issues of technology transfer? Have we looked at issues of intellectual property when it comes to AI? Artificial intelligence is a social good we use for all. Do we patent it? Do we make it for free? Should government subsidize this? It's very, very important. How will government allocate resources into AI-based healthcare products, healthcare services, which will make healthcare accessible to rural areas, underprivileged areas, poor areas, using remote telemedicine, using simple handheld devices, such as an ultrasound handheld devices, which can detect complications or risks during pregnancy, simplify the handheld devices, which can scan the chest and detect tuberculosis, COVID-19, or other diseases. The time to invest is now, because once we invest in AI and there's access to healthcare in remote areas, in poor areas, people will gladly get time to work, resource allocation. People wouldn't have to travel very lengthy distance to hospitals, and this would lead to a decrease in poverty. I showed a simple graph, a chart, which show the potential reduction in the cost of AI, and it's listed AI-assisted nurses, it listed robotics, it listed infrastructure, AI-assisted decision-making, when it comes to health informatics, when it comes to patient data, when it comes to analyzing patient data, diagnostic intervention, therapeutic intervention, diseases, surgery. How do we harness AI? The time is now, and the time for us to invest is now. So I'll end here thanking my collaborators, Professor Michael Wilson, who played a big role in the patent application, my collaborators in Loyola University, Mayo Clinic, my colleagues in biochemistry, WABIB, research assistant, numerous graduate students I cannot count, and my colleagues in the Department of Biomedical Engineering. I say thank you. AI has come to stay. Let's live it ethically. Thank you very much for your time.
Thank you very much, Prof, for this wonderful presentation you've taken us through. I believe that it's a lot of information for especially the newbies to AI and the newbies to health and poverty alleviation. It's a lot of information to divest. And you mentioned correctly that the time to invest now. There are a couple of questions that I'd like you to take. You know, you spoke extensively about the good side of AI, robot-assisted surgery, virtual nurse-assisted surgery. You spoke as if that all is well with AI. You didn't, I mean, you touch a bit when it comes to the economy, like lack of data. But you know, one of the questions is, like, AI is heavily data dependent. It is what you feed it, that is what comes out. It is, I mean, if you feed it with information that is not accurate, you're going to get inaccurate information. You know, but in this part of the world, you also mentioned discrepancies, data is not connected. You mentioned a bit. I mean, most hospitals haven't still started practicing electronic health records. You know, until recently, I've seen some polyclinics, other agencies trying to implement electronic health records, which means when you go, it's not, the information is not in a paper, and it's in the form of, you go through a system and then your diagnosis is pushed to another system. And we haven't gathered data, unlike the West, we haven't gathered enough data accurately to be able to say that we can take advantage of AI fully. What is your take on this? Before we come to the ethical issues of AI and all those things, what is your take on this? What is the way forward for us? How can we also leverage, even though we don't have all the things together, all the pieces joined together, how can we leverage
like
on the advancement of AI?
Okay, thanks. Like I said previously, data is the new gold. And if the government and those in charge of our healthcare system want to improve healthcare, then they need to invest heavily in AI. And issues which pivot around data generation need to give in optimum attention. For example, we have a lot of data in the various hospitals which can be digitized. And we have some few polyclinic and hospitals with electronic health records. All these are fragmented, and we could integrate all this system together. It doesn't take so much for the government to invest in when it comes to data generation in the various hospitals. Each hospital can have an AI assistant or AI data assistant. There are already health informaticians in the hospital. So collaborating, the challenge we face in Ghana is enormous. You find a country which is even less than the country with a population or size, sometimes less than a state in the United States, having to compete globally. But when we look Ghana together with other West African regions, if we can make the West African sub-region an AI sub-region where we collaborate, we connect, we network, and we pull all our resources together and invest in them. That is the case. So why not digitize the assistance system? And look, if you look at other generative AI systems developed, there are existing data sets which were used. You can use limited localized data set to optimize these models, to tailor make them, or to tailor suit them to your peculiar healthcare questions or challenges you intend addressing. So even with the little data available, are we optimizing that? I don't think we are optimizing. Even using the little data, optimize existing models we can be able to answer certain specific questions.
Okay, so there are a lot of questions online on our audience that have joined us on the YouTube page of the U.S. Embassy. I have, are there any specific AI-related sector services or solutions based on what you have done you can share? What are some of the specific actions you would recommend in a bid to address ethical issues in the country? Yes. I don't know if the question is clear.
Oh, yes, the question is clear. Okay. We raise issues of AI can be abused. I mean, we have issues of deepfake where people are doctoring videos, audios, generating videos, compromising the integrity of people. These are ethical issues. These are criminal issues. So with respect to ethics, when it comes to research, the universities already have ethics committees. These ethics committees need to be equipped to evaluate or assess research proposals involving AI or humans when they appear before this institutional review board. And they should be empowered to reject such research proposal or ask for revision or modification or approve it. And this must be done. When it comes to the security services or law enforcement, the question is, we have enough laws in our criminal codes to penalize people who abuse AI ethically for their selfish gains to harm other people in terms of child trafficking and other stuff, or to sell fake medicine, fake products, and other stuff. That is, we need to strengthen our legal system, our criminal code, and other system. When it comes to businesses, important. Are we giving access to the data set when you use certain platforms, applications on the web, on your phone? If there's a traffic CCTV camera at a junction and the CCTV camera has taken a picture of you or an image of you, who gets access to the data? Can this data be sold to a third party for commercial purposes without your consent? Can this data collected be used for military purposes, for oppressive purposes of civilians? Could it be used for war to kill innocent civilians? Could it be used for clinical trials that put children, pregnant women, prisoners at harm? All these are questions we need to ask. So there should be a regime when it comes to business. The Ghana Institute of Engineers, Association of Ghana Industries, and all these bodies need to come in to use of AI data and its application when it comes to business. Can AI be used for business intelligence? Yes, you can use AI for ethical when it comes to business intelligence, but AI can also be abused when it comes to cybersecurity infringement, data security, cybersecurity infringement. That is where AI creates jobs. When computers were coming, people refused to learn computers. If you read the history on the evolution of computers, people refused to use computers. People refused to learn because they thought it was going to take the jobs of secretaries, stenographers, typists. But computers have generated more jobs than we ever thought. We have computer scientists now, we have programmers now, we have bloggers, we have the news media, we have the mobile phones, Android, Apple, Google, the mobile phone platforms. It's being used as a form of intervention in healthcare and the rest. AI can also create jobs. It can expand jobs. There are also fears that AI certain jobs irrelevant. Even human existence evolves. Humans will have to evolve to adapt to challenges of the time. If you look at the grand challenges from the Bill Gates Foundation, the grand challenges, you know that there are specific threats, challenges, which underpins our survival. This will be this, the Sustainable Development Goals, accessibility to water, life on earth, life underwater, education, and the rest. So in terms of our individual skills, we need to evolve individual skill sets and adapt to the emergence of AI in any task that we perform.
Okay, unfortunately, we are running out of time, and I think that we should do a part 2 of this. There are a lot of questions that our audience have asked. They've asked questions about how can we address lack of human oversight with AI in order to avoid exacerbating disparities. They've asked of how can startup Mohammed Sadiq on YouTube has asked, Prof, can you elaborate how these startups can get the necessary support like and mentorship if there is a startup that is using AI to do specific things to help humanity? How can this startup get support? Can you elaborate on it? There's a lot of questions on YouTube, and I'm very sure that we need to do part 2 of this, but just your concluding remarks, how can we address lack of human oversight with AI in order to avoid exacerbating disparities?
Yeah, addressing human oversight with respect to AI is policy, regulation, and then monitoring, and then implementation. That's very, very important. And then knowing who has these data sets and knowing what that individual is doing with the data set, and it must come with consequences. Unethical usage of AI data to the detriment of healthcare, survivability, crime, all these need to be looked at. So I think that is an ethical regime. With respect to the issues of startup, there are few successful startups in Ghana, which I even mentioned Health in my talk. At the University of Ghana Business School, they have a hub there which helps startup. So the issue we have that a lot of people talk about is most of our companies invest in beauty contests, they invest in musical shows, they invest in a lot of activities, which in as much as social well-being, and we need it sociologically to survive, they also need to invest in young talent. For example, in my department, every month run a machine learning and some of them ends up overseas, some of them stays, some of them private entities. There should be boot camp to support AI. There should be and a host of that. Whoever wins the competition get funding, and they need to be pitching. They need to be pitching. Investors need to invest. AI is going to grow to trillions of dollars, and that is where everybody needs to invest in.
That is where everybody needs to invest in.
So AI should be
Yes.
our new galamsey. Artificial intelligence should be our new galamsey. Instead of going to do galamsey, let's invest in AI.
Beautiful
because
conclusion.
Knowledge economy which rules the world. Knowledge economy rules the world.
Knowledge economy rules the world. That brings us, thank you, Prof, for that concluding remarks. And like I said, I think that there's a lot that you want us to know. We need to do a part 2 of this. And I want to thank our audience. I want to thank our audience on YouTube for joining us and for also asking very insightful questions. Please do not miss part 2. Before ending the program, I would like you to know an amazing resource that is available in person in the various American spaces that you might find helpful. And this is the eLibrary USA. eLibrary USA is a state-of-the-art digital library with 9 premium electronic databases that include digital newspapers, magazines, journals, videos, and dissertations. Usually these resources are available in person at American spaces, but now you can have access to it. All you need to do is to sign up to the link that is in the comment box, in the comments section of the YouTube, and you can have access to it. This program was brought to you by the U.S. Embassy Ghana, American Corner Gbugba, in partnership with Mobile Web Ghana. And that concludes our program for today. Follow us on YouTube at U.S. Embassy Ghana for more amazing virtual programs. And thank you, Prof. Thank our audience. Thank everybody for joining us. We've had an amazing session.